What a way to tie in to the theme as we bring this conference to a close. But before I call on the Honorable Minister to the podium, I ask that you indulge me just a bit, as I'd like to thank the sponsors for this year's conference. I'm sure you'd agree that it's been well worth our time over the past 3 days. However, we would not have been able to pull it off without our sponsors, so give me a moment. The Ministry of Health and Wellness for hosting this event each and every year. Health City Cayman Islands, our Premium Plus sponsor. Cayman Islands Health Services Authority, Doctors Hospital and Integra Healthcare, Compass Media, 3T MRI, and Kelly Holding Events and Communications, our premium sponsors. Our lunch sponsor yesterday, DART, Infinite Mind Care, and Aetna for providing us with breakfast. Supporting sponsors, Baptist Health Miami Cancer Institute and HSA Public Health. Our Wi-Fi sponsor, KPMG. Cineco for sponsoring the Health Check Station. And Healthy Futures, the Wellness Center, and Dana-Farber Cancer Institute for keeping us refreshed during the coffee breaks. And of course, we have to say thank you very much to the ladies and gentlemen of the Ritz-Carlton who have taken very good care of us over the past 3 days. And with that, I do invite the Honorable Sabrina Turner, Minister for Health and Wellness, to bring the conference to a close. Let's welcome her.
Good afternoon, and I trust. I'm asking you to trust me that I will not keep you here very long, because I want you to bask in the moment. I want you actually make sure that you take away from this last day, which has been very, very inspiring, and I hope that you were all moved. And for those of us who stuck with us for the past 2.5 days, pretty much, 2 days, that you are more informed and definitely encouraged and pleased to see where healthcare here in the Cayman Islands is going. And I too would like to share and make special mention to definitely Mark Langevant and his team here at the Ritz-Carlton for again doing a phenomenal job of hosting us for the 14th annual healthcare conference. Thank them so much. Now, this conference has come to a close, and I trust that you have been more than informed, and the networking opportunities that were available to us, that you have taken advantage of those. I was able to sit in on all the sessions again, and I am very insightful. And for what was shared definitely is thought-provoking. Many a times my chief officer and I were there whispering because we got a little jolt. She wrote down her notes, I wrote my notes. And it's amazing what ideas can come from these events based on the participation, the back and forth discussions, and based on the questions asked. We're not only seeing it from a national perspective as where legislation and policies are actually required, but definitely from the remit and the responsibility from the ministry as a whole and working in collaboration with all of the industry stakeholders. Now, there have been some key takeaways from this year's conference. The step numbers, the need to educate our public, the step results, preliminary blood glucose levels unveils concerning information on the percentage of our population that has who has a rise blood sugar and glucose diagnosis. But what's the big takeaway here are the amount of persons that are not even on medication. This raises significant questions about health literacy, access to care and medication, and it shouldn't matter what your social status is, and definitely not what your income is, that will determine your access to care and medication here in our country. For the amount of times that has been brought up here over the past couple of days, it's sobering. Sobering, to say the least, that we have all of the expertise, all of the medical and breakthrough evidence that is being shown here today, and we still have people, I don't know if it's shame, I don't know if they're embarrassed or if it's pride, but they shouldn't feel less in going to seek medical care because they don't look or they just don't have the funds in order to seek care. And we all have a part to play in changing and demystifying that concern right here in the Cayman Islands. We also have to look at the health insurance coverage. Definitely, this needs strengthening and review. I am happy to stand here today to report that I have had sight over the draft of the Health Insurance Act and health insurance regulations that are currently under review and constant dialogue back with those stakeholders from within. That is in preparation of it coming to be presented to my caucus colleagues. Once I've received support, then those recommendations will then be presented to Cabinet for official approval, and that's approval before coming into the public's domain for stakeholders' engagement and definitely public participation, because this is just the process, it's democracy, and I am definitely championing breaking down silos. Now, data on those who have never reached such diagnosis, but also the survey results indicated an elevated blood glucose level, highlights the possibility of the hidden burdens of this disease. Always at the top of the list, ladies and gentlemen, is cost. Cost implications, not only on the individuals, but also on those and this country, what we will have to look forward to where resources are concerned, and definitely quality of life is at the forefront. Now, increased focus on preventative care, standards for practitioners, and also measuring what our patients are experiencing has also been a highlight here over the past couple of days. Now, 2012 and 2023 data relating to body mass index, very similar, with 2/3 of the population between ages 18 and 69 being overweight or obese. It's no longer a joke when we say this is just Caribbean, this is how we built a big bone. Many times we're hiding behind the truth. Is it because, as we know, the cost of living is so high, cost of healthier food, making that even more difficult to try and change our cultures and behaviors? But the mere fact that these results are sobering, and you have a ministry and a country that is realizing that we are willing to work together to improve this, as hard and as sobering as the words on Cayman's obesity epidemic need to be repeated and heeded. Do we want to be that jurisdiction, along with other few countries that can claim that 2/3 of its populations are or have unhealthy weight, and 1/3 of their population are dangerously overweight? And that has almost been the norm for years. This is not the Cayman that we want to stand out a part of. We want to be the solution. We want to be able to have and give our people the opportunity to definitely turn that and change that into the right direction. Now, a data-driven approach will continue to unveil hard truths. And ladies and gentlemen, we must not shy away from this as we provide everyone with the opportunity to do better for current and future generation. It starts here, and it starts with each one of us. Now let me highlight the chair yoga. Who liked that if you were here yesterday? I gotta be honest with you, as they say, prayer pressure is something I sat there, I pushed back my chair, and I said, oh, dear Jesus, please let me bend my leg, but please make me get her back down. And it worked. I did it. But simple little things like that that we could do not only at our desk, but we know for persons in the healthcare industry, you're running from one room to the next, one ward to the next. There is a moment that you actually sit down sometimes to inhale even your lunch. Stop and try and implement some of those exercises that we were shown here yesterday. Inhale, exhale, and the power of silence. It's all into self-care. You know, the mental health and wellness in the workplace, identifying and owning up for once the power of touch, the power of presence, the power of a smile, the power of building relationships with each other as co-workers, being genuine and sincere, but also the power of building that relationship with those who are in their most vulnerable state of when they're your patients. I am so excited about the future of healthcare here in our country, and I believe that data and expertise that was shared here with us over the past couple of days can be used to inform the initiatives that are already in the works in the ministry as we continue to shift our focus to public health. As we leave here today, ladies and gentlemen, I am committed more than ever to ensure an equitable, sustainable, and successful healthcare for all in the Cayman Islands. As I alluded to and I stated quite boldly at the opening of this event, we are all in this together. The ministry is here for you. We are accessible, and we want to hear from you. Let me again, for emphasis, thank the Ritz-Carlton, the management and team. I want to thank GIS, who's at the back, definitely have recorded this entire conference. And to you, all of the attendees, both in person and definitely those who were streaming. Our very own Master of Ceremonies, Mr. Ben Mead, thank you so much. Exceptional job. And to our sponsors and exhibitors for their support, and once again, helping us to make this conference a huge success. I would also, yes, thank you. I hope that you got a lot of those goodies that are out there. I also like to take the opportunity to recognize that our local and our international speakers, want to thank them for so graciously giving up of their time to educate us, each from their unique perspectives. As we continue to grow this conference, definitely there's a need for even more public engagement. And I will make this a promise, and if you notice, I'm not even looking at my chief officer right now. When I told you there's more to come, I'm so looking forward to 2024. If you miss any of the sessions, I would like for you to hear them again. They will be available, again, thanks to GIS, on the CIGTV YouTube channel, and that'll be available next week. I encourage you to share what you have learned here over the past couple of days with your friends, families, and neighbors and co-workers. And I would hope that based on the level of engagement and discussions that you have done, that you will see how interactive of a community that we are. There are no Jericho walls. We are accessible, and we're here. That's the only how we're going to move forward. The ministry, thank you. The ministry is already looking ahead to next year's event, and I encourage that you all share your feedback and ideas in the survey that we'll be sending out. This will help us to shape not only the theme, but also to build on making this one of the best conferences in the region. I look forward to seeing you again right here next year, but for 2024, trust me, this would be like the icing on the cake. Thank you again, and enjoy the rest of your weekend.
Thank you very much, Minister Turner. Now, just one last bit of housekeeping. I know some people have asked about the certificates. They're printed certificates at the registration desk, or you can download them from healthcareconference.ky. Ladies and gentlemen, thank you very much for coming. Do have a pleasant rest of your weekend.